right along into the axial skeleton. So in this first week, we're looking at the skull and the bones that make up the skull, as well as some of the foramina or openings that are found in the skull. So in this first week, we're pretty much looking at just this first bullet point, and then in subsequent lectures, we'll look at the rest of the axial skeleton, which involves the vertebral column and the rib cage. So the skull is obviously this nice hard casing that protects our brain, a very delicate structure. It's really not one continuous structure. It's actually a fusion of smaller bones. And the area that demarcates where these bones were once separate bones, or the area of partial fusion, we call these lines suture lines. So while we were developing in utero, inside our mother's uterus, these bones were partially fused. And at the time of birth, they were still partially fused. And then throughout our full development, they become more permanently fused. And what's left is that area of demarcation called a suture line. So we've got a sagittal suture line, which is on top of the skull. It's separating both parietal bones. We'll talk about what the bones are named in a bit. We've got a coronal suture line, which separates the frontal bone, which is kind of the forehead bone, from both parietal bones. We've got a squamous suture line. This is a paired suture, so it's on either side. And the squamous suture separates the parietal bone from the temporal bone, which is a smaller bone forming the floor of the skull. And then finally, we have the singular lambdoid suture. And the lambdoid suture is kind of this V-shaped suture that separates the occipital bone posteriorly from both halves of the parietal bones. So these are our 4 suture lines, and they can be seen on most skulls as those remnants of lines of demarcation. So let's move on to describe each of the bones individually. I'll also mention important features that you want to look out for each of these bones. And remember, as a part of your assessment of this unit, you're going to have to provide the name of certain features. Maybe it's a foramen, maybe it's a notch, maybe it's an orbit. And you're also going to want to associate that feature with its correct bone, okay? And as I go along, that'll make more sense, but make sure that you're describing the feature and then you're also associating it with its correct bone that it can be found in. So the frontal bone is the first bone we encounter, and as I kind of described it earlier, it's the forehead bone. It's the bone that forms most of our forehead. It's usually one bone, although very rarely it can be 2 halves. This is what we call the persistence of a metopic suture. If we have the persistence of this suture line, but typically we do not have this suture line. It's very rare that you find that in a skull, and we have a singular frontal bone. Important features that we want to identify in the frontal bone are the supraorbital foramen. And these are tiny openings for supraorbital vessels right above the orbits of the eye. And to describe what a foramen is, it's a hole in a bone which allows the passage of a nerve or blood vessel or neurovascular structure. So a foramen is going to be different from some of the other features that I'll mention a little bit later down, in that a foramen allows the passage of some type of nerve or artery or vein, or a combination of those structures. I also want to point out here that when we look at the name of this feature, supraorbital foramen, it's going to kind of describe the location of this foramen to us, or the purpose of the foramen as well. So the supra is meaning it's above, orbit is meaning the orbit or the opening of the eyes, for the eyes, and then foramen, again, is that opening that allows the passage of a neurovascular structure. So supraorbital foramen are these openings above the orbit. Next, we move on to the parietal bones. The parietal bones are paired bones, unlike the frontal bone. So they're making up pretty much the lateral walls and most of the roof or top of the skull. And the nomenclature here, so the word is derived from the Latin word parietalis, which means walls. And that kind of gives us a description of where these bones are found. They're found forming the lateral walls of the skull itself. And they're paired. There aren't any unique features that we want to point out in the parietal bone, just simply understanding that they form the walls and that they are paired. Next is the occipital bone. So the occipital bone is the inferior or posterior most bone of the skull. There's one unique feature here. It's called the foramen magnum. And again, foramen meaning that it's an opening that allows the passage of structures, and magnum because this is actually the largest foramen that's found in the skull. And we can kind of imagine why it's the largest foramen. That's because it allows the passage of the spinal cord. So one of the largest structures that are leaving the skull, the spinal cord, does so through the opening in the occipital bone called the foramen magnum. Another feature found here in the occipital bone are the occipital condyles. And let's kind of describe what a condyle is first. So a condyle is a bump or a smooth surface that allows for the articulation of one bone to another. And when I say articulation, I simply mean connection, or these two bones that are coming in contact with each other. So where the skull meets the first vertebra, which is pretty much the head-neck attachment, we have occipital condyles that are communicating with that first vertebra. Another feature here is the hypoglossal foramen. This is going to allow for the hypoglossal nerve, one of our cranial nerves, and it's also found in the occipital bone. Moving on, we've got the temporal bones, another set of paired bones. Now the temporal bones are found just beneath the parietal bones, and they're going to be forming part of the lateral wall, but also more importantly, the floor of the skull. Important features in the temporal bones are the external acoustic meatus. And a meatus is an opening that leads to the inside of the skull. So we want to separate or distinguish a meatus from a foramen from a fossa. A foramen, we said, is an opening that allows the passage of structures. A fossa is simply a groove or a depression. So it's simply a groove or a depression that kind of facilitates the articulation of another structure. And then we want to distinguish that from a condyle, which I mentioned earlier. A condyle is a smooth bump where two bones articulate. Another important feature here is the zygomatic process. So the zygomatic process continues on to form the zygomatic arch. This is an articulation with the zygomatic bone, pretty much the cheekbone. So the hard surface that forms the cheekbone or the inferior surface of the orbit of the eye is called the zygomatic arch, and it's actually formed partly by the zygomatic process of the temporal bone and partly by the temporal process of the zygomatic bone, which we will speak about later on. Next is the mandibular fossa. Now the mandibular fossa, again, is a groove or depression that allows for the mandible to come in contact with the temporal bone. This area we call the temporal mandibular joint or the jawbone. And so when you feel your jaw moving or articulating as it opens and closes, it's actually coming in contact with the temporal bone at the mandibular fossa or at the groove that allows the mandible to manipulate itself in that fossa. Lastly, we've got the styloid process. The styloid process is the sharp projection of the temporal bone. And this is really an attachment for some muscles that we'll talk about in another unit. So the styloid process is simply a sharp, pointy projection of the temporal bone that allows for attachment to some important muscles. And if we look at the word styloid, we're going to talk about another term or another structure later on that uses this word styloid. It actually comes from a Greek root word, which means pen-like. And as we can see, this is a very pointy projection, which kind of gives us an indicator as to the shape that we're describing here, kind of a pen-like shape. Continuing on with the temporal bone, let's look at some of the openings that are found in the temporal bone. We've got the carotid canal, which allows the passage of some of the carotid structures. We've got the internal acoustic meatus, again, a meatus leading to the inside of the skull. This is the continuation of the external acoustic meatus. And then we've also got the jugular foramen, which is a sheared foramen. It's made partly by the temporal bone and partly by the occipital bone, which we talked about earlier. All right, let's move on to the zygomatic bone. I was speaking about the zygomatic bone and the zygomatic arch earlier. Just to remind ourselves here, I mentioned that the zygomatic arch is this shared structure. It's made partially by the temporal process of the zygomatic bone, and then partially by the zygomatic process of the temporal bone. So these two processes articulate, and that's what forms our zygomatic arch. And that's what we kind of appreciate as the jawbone, or the inferior part of the orbit of the eye. And just to kind of give some clinical reference here, the zygomatic arch is an area that is usually susceptible to fractures. So if you get punched in the face, or if boxers usually have this injured or fractured because of its location, and because of the fact that it's really two bones coming together and it's not a solid bone on its own, it's really susceptible to fracture with any injury to the face.